Today we're covering a critical topic for your phlebotomy exam: site cleansing and the correct use of 70% isopropyl alcohol, chlorhexidine gluconate, and povidone iodine. The exam will absolutely test your ability to choose the right antiseptic for the right situation. For routine venipuncture, such as a basic metabolic panel or a complete blood count, 70% isopropyl alcohol is the standard of care. The exam expects you to know the proper procedure. Cleanse the site with the alcohol pad for 30 seconds and then, crucially, allow it to air dry for at least 30 seconds. This drying time is not optional. It's when the antiseptic action actually occurs. An exam question might present a scenario where a phlebotomist immediately begins the draw after wiping, which is an incorrect action. Now, for procedures that require enhanced sterility, like blood cultures or arterial blood gases, you must use a stronger antiseptic. This is where chlorhexidine gluconate or povidone iodine comes in. These agents are superior for reducing skin flora that can contaminate a blood culture sample. The exam will test this by asking you to select the appropriate cleanser for a blood culture draw. Choosing only isopropyl alcohol would be incorrect. A common exam trap involves patient allergies. Before using povidone iodine, you must check for allergies to iodine or shellfish. If an allergy exists, chlorhexidine is the appropriate alternative. Another major area for exam questions is the cleansing technique itself and post-cleansing protocol. You must clean the site by moving in concentric circles, starting from the center and moving outward. But the most critical and frequently tested mistake is re-palpating the site after it has been cleansed. If you touch the site to recheck the vein's position after disinfecting, you have contaminated it and must clean it again. Expect a question that says, after cleansing the site with chlorhexidine, the phlebotomist re-palpates the vein to confirm its location. What is the next appropriate action? The only correct answer is to disinfect the site again. Finally, let's consider a special case: a blood alcohol test. Using an alcohol-based cleanser would contaminate the sample. So for this specific test, a non-alcoholic antiseptic like povidone iodine or chlorhexidine gluconate is required. To remember the basics, use this phrase: alcohol for the regular, iodine for the bug jar. This helps connect routine draws with alcohol and infection-sensitive tests like blood cultures or the bug jar with stronger antiseptics like iodine or chlorhexidine. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.